And we live. Welcome to another Everybody Can't Go Convo. Happy Wednesday to you, and thank you for tuning in. Today, I have an extra special guest for you. You know, all the guests I bring on, folks near and dear to my heart, people that got all of the tea that you need, all of the teachings that you need. So today, I have coming straight out of Howard University, Dr. Raven Holmes. Welcome, Raven. How are you today?
Good. It's good to be here. Good to see you, Jesse.
Awesome, awesome. And thank you so much for joining on. So, we will go ahead and just get straight into it. Go ahead and give us a brief introduction of yourself and let us know what you currently have going on in your business and in your field. And we'll get straight into the conversation today, girl.
Yeah, well, like you said, I'm straight out of medical school. I just graduated like 3 weeks ago. So it's still weird hearing the doctor, Raven Holmes, still getting adjusted to that. But during medical school, during those 4 years, for two of them, I worked as a psychiatric rehab counselor, which I still do now. I'm actually going to stop working there because I'm starting residency in psychiatry in about a month. So that's kind of where I am between medical school and starting residency in psychiatry. So in that little transition period, so I'm getting a little bit of a break, but still working with some of my clients in the psych rehab program.
Awesome, awesome. So, one of the questions I know that people are going to have is what is the difference between going to see a psychiatrist versus going to see a therapist, a licensed therapist?
Yeah, so psychiatrists and licensed therapists often work hand in hand. A psychiatrist can refer to a therapist, and a therapist can refer a patient to a psychiatrist as well. But really, a couple of things are different. One is the education. So psychotherapists can be social workers, they can have PhDs in psychology, and psychiatrists are medical doctors who go to medical school for 4 years, followed by 4 year training in residency in psychiatry. And so that's really the difference in the education. And then as far as practice, therapists really focus a lot on different modalities of therapy. So cognitive behavioral, psychodynamic therapy, those sorts of really good talk therapies and those sorts of kind of giving patients and working with clients to get those coping skills together so they can deal with their mental health in that way. And psychiatrists sometimes can also do psychotherapy, but they're also focused on more of a biomedical sort of approach to mental health. So things that can affect mental health that are biological or pathological. And so you can do psychotherapy in addition to medication management. So that's really kind of the difference is that psychiatrists can also prescribe medication. But again, mental health is such a complicated thing to treat that it's really important to have psychotherapists and often psychiatrists involved.
Awesome,
It's really a
awesome.
collaborative relationship the way I think about it.
Okay, that makes a lot of sense. You guys, we got the framework here, and you know where I'm going to take us diving into this thing. We are wrapping up Mental Health Month. And, you know, around here, we talk about mental health, the effects of your social circle, and the choices that you make on your mental health inside and out, and looking at things holistically. So we're going to jump straight into it. I have some questions for you today, especially with your background and your expertise in the field, and that you'll be able to give us a little bit of a different perspective as we've had therapists in some past episodes to speak to the audience. One of the first things that I wanted to find out was how can social situations and relationships contribute to or diminish our mental state when we're looking at those that surround us, who we surround our life with.
Yeah, well, I'm glad you said contribute to and diminish because they really kind of can do both. I know in my field, what I've been doing with psych rehab counseling, I'm working with kids and teenagers. A lot of things we work on with them have to do with toxic friendships, for example, versus healthy friendships. And so I think friendships, relationships, relationships are extremely important. They can help us feel less isolated. They can give us a sense of belonging. They can really give us like a little boost of dopamine. If you ever like go out with your friends, kind of have some fun with your friends, you come back, you're in a kind of like a better mood. It can give us that effect. And so it's really important. It's part of the needs we have as humans is to have that human connection. And having those relationships in a good standing can often be good for our mental health. But there, of course, is a flip side where if you feel like you're not getting the support you need, for example, from your social circle, or you feel like relationships in your life that are important to you are not in the best position or not in the best standing, it can negatively impact our mental health. It can make us feel more isolated. For example, if we have maybe friends that are not meant for us, or friends that might be contributing to toxic behaviors, right? So it can make us feel even more isolated. So really, it can be twofold. So it's important, but at the same time, you have to kind of monitor who is in your circle and how they might be contributing to your mental health, either positively or negatively.
Okay, that makes a lot of sense. All right, y'all. Y'all heard the clinical version of everybody can't go. We getting it every which way up in here. So when you started to talk about those toxic relationships, what would be like some of the symptoms per se of like those quote unquote bad relationships or toxic relationships, the friendships, the family dynamics? What are some of the symptoms that may show up in our mental and our physical health that we could like watch out for?
Yeah, well, so for mental health, for example, one sort of thing you can pay attention to if you might be around maybe more toxic relationships is you might feel what we call anxiety, or a constant sense of worry that you're not able to control. And so that can impact things like your sleep. That can impact things like your digestive health. You might be like, I'm having stomach aches all of a sudden that I wasn't having before. I'm having headaches that I wasn't having before. Or you're not able to sleep as well. Or you feel like you need more sleep, right? Kind of the symptoms of anxiety, symptoms of depression, for example, those might start to show up for you in a way that they had not in the past, or they had not previous to this relationship. Um, Things like you're not enjoying the same things that you used to enjoy when you start to think about this particular relationship, whether it's a friendship or intimate relationship. You might not enjoy the same things you wanted to enjoy. You might feel more fatigued than normal, and sometimes they can be very subtle, and you might still even be functional. But I think in that sense, it's really important to continue checking in with yourself. Are you more irritable than you are normally? Do you feel like you're more emotionally labile, or you're able to go from one extreme to another more frequently? Mood swings, for example. Those are kind of things that might alert us to there might be something wrong in the relationship, or we're just not getting what we need from it in that moment.
Okay, that makes a lot of sense. And I know that all of these symptoms and things that you mentioned that we could look out for, that's stuff that it could be triggered by pretty much anything in life. And so I think a lot of times we could tend to, oh, well, if it's your stomach, oh, it's something that I ate. I shouldn't have had burrito tacos, or I shouldn't have had dairy or something like that. Or if you're feeling fatigued, oh, I did a couple extra workouts. It's just the workouts, any of those different things. And I like that you brought up that we would need to pay attention to ourselves. We've been talking about for the past couple of weeks here about self-awareness and emotional intelligence, and making sure that we're checking in with ourselves, like you said, making sure that we're not just doing like those body scans of physically how do we feel, but like how are we feeling here and how we're feeling here. And when you aren't
Yeah.
accustomed to doing so, or you don't get those small reminders, whether it be from yourself or from the people around you, like, hey, have you checked in with yourself? Some of those things that you just mentioned, they can just, you wouldn't think two things about it, and or attribute it to something else.
Yeah,
So I would say for you
absolutely.
guys, be
And self
sure.
awareness, what you said, is probably the biggest thing.
Oh, you go ahead.
Yeah, self awareness, like you said, probably is the biggest thing to focus on, because, like you said, and I've said it out loud before to my friends, I'll say things like, I don't have time to fall apart. And so then you kind of start to feel things more physically. If I don't have I'm not able to have the ability to just stop doing everything, right? I still had to go to school. I still had to take care of the home, things like that. So then I was like, I'm starting to feel like I'm having stomach aches, things like that. So you have to really check in with yourself and know that, yes, like you said, maybe I did go too hard at the gym one day, but is this abnormal? Does it continue to happen? Has it been like a 2 week span where I'm feeling like this most days out of those 2 weeks? And then really that can kind of hone in on, maybe it's something more than just a stomach because I ate something badly. So I think, like you said, self-awareness really is the most important part of it.
Okay, awesome, awesome. So make sure you guys take that inventory of yourselves. And if you're having any aches and pains, any of those symptoms that we just talked about, make sure take some time, at least give yourself 5 minutes so that you can take some time, quiet time alone by yourself, so that you can really think about what's going on to be sure that you're able to kind of isolate what is causing you to have some of those feelings and symptoms so that you don't misdiagnose yourself. The next question that I have for you
Absolutely.
is when when does this start to become damaging to our mental health? Like once we start feeling these physical symptoms and we're continuing to either be unaware or just don't know, when and how does this become damaging to our mental health?
Well, honestly, I think one thing about psychiatry is, I say that it's mind plus matter. We've heard before mind over matter, but the way I think about psychiatry is really mind plus matter. So if you're at a point where things are manifesting in a physical sense, I would say that that is a sign that your mental health is already being affected. But even before you get to a physical level, if you're feeling like your sleep is affected, you're not getting the sleep that you need every night. You're lying in bed, maybe tossing and turning, not able to turn off those thoughts in your head, or you feel like you need to stay in bed all day. You feel like you're way more fatigued than usual. Or if you're starting to isolate yourself from your friends. And one thing I always like to say is kind of trust your friends, trust your family. If your friends or family are saying to you, Raven, we haven't seen you in a while. Like that doesn't feel like you, because they might notice things about you that maybe you did not hone in on in yourself. Um, but if you're worrying about things that you wouldn't usually worry about, and not just worrying but truly not able to control that worry, those are things that can let you know that maybe it's time to seek help other than just in within myself. It might be time to seek help from a therapist or from a psychiatrist. But or if I'm maybe, let's say you start to try to find other ways to deal with your stress, whether it's maybe I'm drinking a little bit more wine here and then. That could be not necessarily always a negative thing, but it could also be kind of a hint that maybe something is abnormal that I need to address further.
Okay, that makes a lot of sense. Now you know that I'm not just doing this for y'all. This is for me too because we on this learning journey together. She done said one of my key words, y'all. I gotta track my wine intake because if the wine is disappearing too quick, I'm like, hold on, let me
Listen,
start doing inventory right there.
it's very true. I'm the same way, and that's why the things that I talk with my clients about, things that I will talk with my patients about, things I talk with my friends about, are things that I also experience myself. And I feel like, especially being a Black woman going into psychiatry, I want to be able to relate to my patients on that level. It's like it's never coming from a judgment. It's more just like, girl, let me check in with myself because maybe something is off that I wasn't thinking about. And sure, I love to have me a glass of wine, but if it's starting to get to a point where I'm like, okay, am I drinking because I'm sad? Then that could be something that tells me maybe I need to more address what the underlying causes could be. What am I sad about? What am I feeling extra stressed about that I feel like I need, that wine would make me feel better. So again, it's not coming from judgment. Have your glass of wine. It's always just about checking with yourself and kind of being able to see, is there something more to it? And if not, great. But if there is, maybe this is a time you can reach out for different resources.
That makes a lot of sense. Yeah, and that is definitely something to consider. I started a couple years ago. I would just start to ask myself why about everything. Sometimes I would literally sit there, like when I'm on my way to the kitchen, if I'm about to grab something, it's like, am I winding down? Am I doing this out of habit? What emotions am I feeling? Do I want this for
Mm,
taste? Like, let's do an assessment here before we pour the glass of wine or before I go open a bottle of wine. And what that started to do for me was it
mhm,
started to like it started to make me question everything, anything that I was choosing to do or to consume, like whether it was watching TV, if I was, like you
mhm,
said, not feeling like going out. It's like, do you really not feel like going out, or are you feeling down about something? And that gave me that
mhm,
space so that I could like turn to friends, and it's like, have I been missing a lot of, or sometimes I would do that inventory myself. Like, I missed 3 things in a row. What was I doing? Sitting on my own couch with my legs crossed, eating popcorn and watching Netflix. And I'm like, you know what? I probably should get up
Right.
and get out, and I should go do something and be social. And so sometimes the questioning of self, when you're asking yourself the right questions, that can be a positive aspect to helping yourself to stay on track. Those are some of the things that worked for me.
Yeah, and truly it's all about balance, because there are times where some people really recharge around people and some people have to recharge by themselves. So you'll meet people who they go out with their friends, they have a great time, they come home and they feel energized, right? And there's some people
Mhm.
who have kind of like a social battery, that they'll go out, have a great time, but they come home and they feel depleted. And so those are the people who might need some extra couch time. I know I'm a person who, I can't go out every day on the weekend. I need to have like a day of going out and a day of recuperation. And so it's about having that balance. So if there's days that you're like, I need to just sit at home with my popcorn and my glass of wine, that is great. But like you said, taking the inventory of, am I doing this because I'm feeling sad? Am I isolating myself on purpose? Or am I taking time for myself because I need to recharge after a long week? And so that's where it can sometimes be really hard, though, to have that self awareness. But if you have friends reaching out to you and they're like, well, you're my bestie, you missed my birthday, you've never done that before. That could be like an alarm that says, okay, something might be different than usual. It's not just my normal needing a day off or needing time for myself. It could be that I'm feeling maybe more depressed than normal. I'm feeling more fatigued than normal. Something about going out is making me anxious. And it doesn't have to be alcohol. It can be, it could be food. I know I'm a comfort eater. You have to kind of check in with yourself. Am I eating because I'm bored? Or am I eating because I'm anxious? Those are things we have to kind of, like you said, I like the words you said, use it, do kind of like a self inventory and check in with ourselves.
Yes, for sure, for sure. The more that I start to dig into self development and growth, and just the whole growth mindset and everything related to it, I go off into down all of the little rabbit holes, and there's so much from the mental health care space that clinically it literally just bridges straight over. And I've done so much research over the past, oh gosh, I don't even know how many years, but every time I find something that it's like, oh, you know what? That's a good tidbit. I'm just going to pack that in my little self care pack here, and, keep all of these things with me. Some of them, after repetition, it becomes kind of like second nature. And it's good to be reminded that
Mm,
some of the things that I've like kind of packed into my own mental health toolkit, that there are still teachable moments there and things that can help other people, that now I'm just like, it's like grabbing a bottle of water while you're walking through the
right.
kitchen.
Exactly. Yep. And self care probably is the biggest buzzword. And I don't know about you, but when I was growing up, it wasn't something that we really talked about. There was no vocabulary for self care. And I feel like
Yes.
our generation and the generations after us, my youngest brother is 16, and he has mentioned self care, something that they talk about even at school. And so I'm very encouraged to see that people who are now growing up are hearing about self care, and that it's important to take time for yourself, whatever that looks like. So I'm glad to hear more talk about self care.
Yes, that is, girl, that is one of the buzzwords around here. Two things that we always gonna talk about is self-care and some boundaries around here, because that is so important to being that whole healthy person that we're striving to be. And then also those are two of the big things that, look, you got to remember that everybody can't go when you're talking about how you're going to care for yourself, as well as setting up those boundaries. Boundaries are a form of self-care here, okay? So those are two things
Yeah,
that we always
absolutely.
revisit.
Mhm. Absolutely. Yep. Definitely the boundaries, and even talking about how relationships can play into our mental health care, right? So it's, if you're not setting those boundaries, you might start to notice that your mental health is being affected. So boundaries plus self-care is wellness, if you want to put it that way. I totally agree with you.
Look, that's a t-shirt right there. We're gonna have to have Dr. Raven Holmes sign that one on the bottom, okay? It'll be in the merch store for you guys, coming to you soon. So as we keep moving with our with the questions, because I want to make sure that I get through all of these, because like you are a wealth of knowledge, and like you just have like such like bomb responses for some of these questions, and it's like sparking so many things that That some things that I've known, and some things that I'm like, ooh, wait, didn't know that. So
Mhm.
when as a clinician, when you're speaking with clients about like relationship issues, how does that work in a clinical aspect? Like, do psychiatrists end up dealing with like, because okay, in the movies and on TV, it's like, "Oh, I'm going to the psychiatrist, I'm going to sit on the couch," and so there's like that stereotypical brown couch with the little buttons on it. So as a clinician, do you guys deal with like the drama and the fallouts from relationships uh, with your clients, and then like what does that look like for you guys?
Yeah, well, so before I was even in medical school, I was a case manager, which is really a social work type position. So, any of the therapists or social workers you've had before on your podcast can attest to the fact that you hear a lot of the drama. Yes, you do. But often it can take time to build up to that point where you spend a lot of time and maybe several sessions building just rapport with your patient or your client, kind of just building the trust. So, just making like pure small talk with them. But yes, it eventually, if a patient is truly engaged in their care, a lot of times what will come up are things like relationships, whether it's friendships or family relationships or intimate partner relationships. Often those do come up. I think that being in this position, one of the best skills you can have is listening skills, and kind of just letting the patient sometimes guide where the session will go. um, I think that's probably the best tool you have is just you want to do, often you'll do more listening than you'll do talking, especially in the earlier sessions when you're first meeting with a patient or first meeting with a client. And then yes, of course, you eventually get to kind of the crux of whatever might be driving them to even seek therapy or seek psychiatry services in the first place.
Mhm. Okay, that makes a lot of sense. So, when you were talking about like just going through like discovery and listening, so that you can get into those things, what are the advantages of speaking with a clinician, in addition to pretty much like venting to those trusted friends or close friends or family?
Yeah, that's a great question. And so many of us have friends we vent to, and that's great. That's an important kind of part of your mental health journey. And I will speak just from just, I'm not a therapist and I'm not even trained in psychotherapy yet, just because I haven't even started a residency yet. But psychotherapists, whether they're social workers or whether they are psychologists with PhDs, are so important, and they spend years of training and hours and hours and hours of clinical work learning how to spot certain things that we might mention to them, and they're able to kind of help us channel those thoughts and develop more of the coping mechanisms. They're also unbiased, right? Whereas your friends, you might be complaining about, whoever, made you upset that day. Your friend already has all this kind of ideas about this person to begin with. They're not truly unbiased. But there's different types of therapy. Again, I mentioned there's things like psychodynamic therapy or cognitive behavioral therapy that people who work in that space spend years training to learn how to do. And so it really is a very different thing, venting to your friends or family versus actually seeing someone who's trained and licensed to give you health care. The way that I think about mental health is I think about it as primary care or preventative care. The same way when you go see your general practitioner, you go see your primary care doctor. I think of psychiatry and psychotherapy as the same way. You wouldn't go to your friend for a pap smear, right? That wouldn't be, unless they were an OBGYN and you were paying them. But
Right.
so I think that the same way, going to someone who's trained and licensed to be able to give mental health care, I think makes all the difference.
That's good. That's really good. So when and I ask that question because sometimes I'll hear people are like, "Well, girl, you my therapist," and I'm like, "Oh, wait a minute, I'm not a licensed clinician. I there's a difference between therapy and advice." And you guys that are listening,
Right.
look, I run it back a few episodes ago. I remind you guys of this all the time, that I'm bringing to you clinicians because I am not a clinician. And though both sets of information may be helpful, there is definitely a defining line in different ways that both of those sets of information can help you. And so, personally, I'm not an advocate of one over the other. I'm always an advocate of the and, not either
Mm,
or. Because there may be some spots in there that if you're only picking either or, you may be shortchanging yourself a bit. Like you said, that having that trusted friend circle or family, whomever you're close with, that is an important piece of that mental health and our sense of belonging. That's part of the reason why I'm like, yeah, no, you can't just go to your clinician, and because it's like, one, you giving her more work to do, y'all. Because you're supposed to have that healthy social circle and family circle around you as well. Um, and also with that, I will remind you guys, even if things are not, everyone isn't going to always have a picture perfect family. Even if you don't have the family that you were born into, if you didn't win the family lottery, I am sorry, but there is still a way for you to have closeness with the family that you choose, the family that you find along the way. So I don't want anyone to
mm,
feel left out, or that when we're speaking of family, we mean blood relatives only. There's the family that you were born into, the family that comes from you, and then the family that you find along the way. So either way, you will be surrounded by friends and family as long as you choose to let those good people into your life and keep them as well.
yeah. Yeah, chosen family is so important and can often be just as important, if not more important, than the family that you're born into. Because as you become older, even going back to healthy versus toxic relationships, you might start to notice some of those elements playing out in maybe your blood family. So you choose to associate with more of your chosen family. So I'm certainly glad you made that distinction.
Yes, of course, of course. Sometimes we and that's definitely you guys know that that's an entire chapter in the book, is talking about, how everybody can go touches the family situations as well. And I never want to leave anyone feeling discouraged when we begin to talk about friends and family. And I'm always putting that reminder out there that, sometimes, you may hear toxic things coming from your blood relatives as well. And there is a healthy way to deal with that as well. Just because you
Mm,
can't proverbially throw them away, that doesn't mean that you have to suffer in silence, that you have to have a boundaryless relationship with that family
mm,
member simply because they're related and you can't get rid of them. There are definitely healthy ways that you can be in proximity or not, and to maintain such a relationship or not. And
mhm,
also for those of us who have, whether it be by choice or by force, folks that have completely separated or moved themselves away from their blood relative situation, that there's always an option. And I know that sometimes that can feel isolating, and
mm,
it kind of gives that alone feeling, especially holiday time, anytime that you're looking around and, oh, everyone's with their family. And I'm
mm.
like, I remind people all the time, like, I don't even know how many moms I have. There was one mother that birthed me, but all of my best friends, they mama is my mama too. They family is my family too. So just don't be down on yourself just because you aren't still attached to the family that you came from, because there are options and healthy paths that you're able to choose for yourself, especially if the familial situation is damaging or toxic.
Yeah, and there's a quote that I always like to remember, which is, you haven't even met all of the people who are going to love you yet. So if you're feeling like you don't have that support system now, there are still people that you're going to meet that are still going to love you. You haven't met all of them yet in your lifetime. So I think that's always something kind of nice to remember, is that on the journey that we're on, we are constantly meeting people who we choose to become our family.
That is awesome. And that is so true. Look, we might just have a whole Raven Holmes collection in the merch, y'all, because that was a
Thank
gem as
you.
well. Okay. And so as we continue to move forward, one of the other things that I wanted to touch on, and we spoke about it a little bit earlier when we were talking about self care. A lot of times here on the show, we talk about look, self care is not a luxury, it is a necessity, and it does not have to be
Mm.
expensive. As a mental health professional, what are some of the ways that you encourage your clients to maintain mental health and clarity on a daily basis? What are some of those practical things?
Yeah. So again, self-care, especially with the kids and teens that I've worked with, is something that we talk about very frequently. One thing that we don't give enough importance to, I think, is again sleep. So going to sleep at the same time every night and trying your best to get your 8 hours of sleep. I know it's very difficult, it's very rough, but making it a priority to get sleep, that is a very important part of self care. And then doing things that you enjoy. If that is working out for you, that might be something that you enjoy. If it's watching Netflix, if it's binge watching a Netflix series, that can be your self care. But one thing that we always work on is really talking to yourself nicely, self talk. It's a lot of us will notice that the voice that we have, our inner voice, is probably someone else's voice that maybe we heard when we were kids. Maybe it's something that was said negative about us when we were younger. And so that kind of becomes our inner voice. Really making an effort to speak to ourselves nicely and give ourselves the same grace you might give to someone else that you love. Treating ourselves like we're someone that we love, I feel like is very important. But, finding a new hobby. For me, I'm someone who will kind of try various hobbies. Right now, I'm playing chess. When I play my chess games every night, for me that feels like self care because it's something that I'm just focusing on that one game in that one moment. I'm not worried about what's been going on the rest of the day or what I've got to do tomorrow. All of my focus is on that. Think people that I know make jewelry, for example, and you're just focusing on that. So finding maybe an activity that you didn't like in the past. I just started playing chess 3 months ago, 4 months ago. Finding a new hobby can be a great form of self care. If your self care, again, if you're someone who likes to recharge with people, going out with your friends, maybe making a priority that once a month or once every other week, I'm going to go and have dinner with one of my friends. We're gonna go try a new restaurant. That can be self care. Putting on a nice robe and just like sitting in the house and doing a facial can be self care. Because like you mentioned, it doesn't have to be expensive. It can just be, putting on a nice candle that you have and sitting on your couch. You just showered. You do a little face mask and just sitting on the couch and watching TV can be self care. So really, it can be so many things, and it can change. You can decide what your self care is maybe this Friday, and the next Friday it's something completely different. You have the options. It's your time for you. So do what makes you feel good.
All right. So y'all heard it not just from me, but you heard it from the doctor. So follow the doctor's orders. Now, one other thing that you mentioned several times was the children and teens that you work with. Are there any things that you would advise for parents that they could keep an eye out for um, to to kind of notice whether or not if their child is starting to have difficulty in their friendships, or if there are any symptoms that they can keep an eye out for?
Yeah, no, absolutely. And, teenagers, I remember being a teenager. Teenagers are naturally, they're trying to test the boundaries of their independence. So a lot of times they might be just naturally more reserved and maybe don't share as much. But I think parents are really the first line of intervention if there could be a problem. Because if you've had this child you've raised since birth, then all of a sudden you're realizing they're isolating more. You're realizing that they're not eating like they used to eat, or they seem more preoccupied with their appearance in ways that you don't feel like are healthy. I feel like if you have a doubt, if you have a question, you can ask your child about it. They might not always be willing to offer up information, but I think being very attentive and then letting them know, if you're not comfortable talking to me, here's someone else you can talk to. And that can be really important, kind of getting those interventions sooner than later, but trusting your instinct to be like, this does not feel normal. Yes, she's a teenager, or yes, he's a teenager, but could they be experiencing bullying at school, which has been very prevalent. Now with social media, bullying is an even bigger problem. I could not imagine being a teenager in today's society where social media is such a huge thing that it was not that big of a thing when I was a teenager. So I think really being attentive to even what might be small changes and intervening early can truly be life saving when it comes to teenagers, especially.
All right, awesome, awesome. I always love to drop the nuggets there or have someone to drop the nuggets there for the parents, especially coming from a professional space. I know in our communities, a lot of time that parents are like, oh, well, there's nothing wrong with you, or you don't need to see a clinician. Some children are lucky enough to be exposed to or be able to go in and see someone.
Yeah.
And so I always ask for a few tips, a few little things to jot down, just in case it can help any of our parents.
Yeah, and like you just said, I think that when I was young, when I was a teenager and a kid, mental health was, and it still is, but it was even more stigmatized. So, you
Hmm.
saying, nothing's wrong with you, you don't need to see a doctor, or, we're going to pray about it. Although, praying about it can be so important. Faith-based psychotherapy exists. That's so important. But could it be that more services are needed? And are we willing to take the chance that maybe it is something deeper? Is it worth just getting evaluated? Because if it is, then you can intervene. It's not worth the risk of maybe telling a child, you snap out of it. That to me feels much riskier than maybe just getting evaluated by a clinician.
Okay, that makes a lot of sense. And finally, before we part ways here, one of the things that I talk about as far as therapy is concerned, or seeing a clinician, I like the idea of seeing a clinician, no matter who you are, whether there's anything going on or wrong at the time or not, just to have an outside source for pretty much, I call it maintenance, for your mental health maintenance, so that
Yeah.
you aren't just popping up when it's like, I'm super stressed out, I need to see someone. It's okay to see someone when there's nothing wrong, and just to
Yes.
help you get some healthy coping mechanisms to make sure that if something is starting to deviate in your behavior, that you're able to kind of get it early before things start to get out of control. Do you see that happening often, or should I stop telling people to go for maintenance visits in between?
No, do not stop. Again, the biggest thing that I say is mental health care equals preventative care, which is exactly what you just said, which is that getting treated for your mental health, checking in with your psychiatrist or your psychotherapist regularly is maintenance, right? It's preventative because they might notice slight changes that maybe you weren't noticing, right? And it's so important just to, when you're feeling good, people are less likely to seek those services, but it really is about getting the coping strategies in place for when maybe you're not having such a great time. You're going through maybe a trauma. You're trying to face a grief. Um, Having those strategies in place early can be, sometimes, and not to be dramatic, because to me it's not, it can be life and death often, right? So I think that please continue telling people that psychotherapy, mental health care is maintenance care, because I think that is truly so important, and I hope that we get to a place where it's not as stigmatized, and I think that we really are getting to that place where even 5 years ago, seeking mental health services was very taboo, whereas now I think we talk about it much more. I think generation coming after us talks about it openly. They're saying words like "I'm feeling triggered," something that I never was taught to say or taught to even recognize within myself. So I do see it progressing towards a place where people are much more open to getting therapy or getting psychiatric treatment. I think we have a lot of work to do. I think conversations like this are a great way to kind of progress towards decreasing that stigma. People like you who tell us maintenance care is so important. And also at the same time, one thing I tell people, and I've had friends in the past who maybe might be going through a depression, and at that time it's so hard to find a therapist because you lack, even like, you're so fatigued, you lack even the motivation sometimes to do the basic things you need to do, let alone trying to search through pages and pages of therapist names or psychiatrist names. So having those people already in place, that way when you do, if you do face a situation where you're feeling more anxious or you're feeling more depressed, you already have that person in place that you trust. That can be life altering.
That is a great idea. That is really good. So you heard it. Make sure that you get a therapist or a psychiatrist, someone as a part of your care plan. You know, well, we should, and if you don't, get your PCP assigned, your primary care physician. But the same way that you have a PCP assigned, you should also look into having a mental health care professional that is there with you as well. Like she said, I could only imagine, you know, a trauma happening, and then now the burden is on you after there's already a burden on you to now find someone to talk to your burden about. And so if that is one of the things that keeps you on your friend's couch instead of on the proverbial mental health couch, there are ways and things that you can do to make sure that that doesn't happen. And it just gives you one more couch that you can go sit on. You don't just have to be at the one couch, and make sure that you're getting both kinds of mental health care. And don't forget those ways that mental health, it streams right into how you're feeling physically. And if your body not right, what else can you do? So, with that, I thank you so much for joining us today, Raven. It has been quite a pleasure, and this has definitely been a treat for me. And I know for the guests, it's because I'm gonna just speak for y'all. So, thank you so much for joining us today.
Thank you for having me. I had a great time. I'm always happy to chat with you about mental health and mental health stigma. This was amazing. I'm glad to hear that you're working on your self care. I'm also working on my self care. So I'm glad to be with you.
Thank you so much. So, we will also be glad to have you back. So, you guys don't worry if you didn't get enough of Dr. Raven Holmes today. Please believe she will be back for you guys in the future. Let us know what you think in the comments. If you have any questions, go ahead and drop them in the comments, and we'll be sure to get answers back to you. I'll get you to the right resource. Thanks, guys, and have a great, happy Wednesday. We will see you next week.